Acupuncture and herbal remedies are catching on around here, but they're not a key feature of American sports medicine. Here, these alternative medicines aren't alternative at all. They're standard practice. So how will Beijing blend the best of East and West to keep everyone healthy? In this episode, this New York physical therapist is himself a blend of East and West. How he caught Olympic fever and returned home to China to keep its Olympians in fighting form. And doctors at Third Peking Hospital are rooting for their patients, not just to recover, but to win Olympic gold. Then how Beijing CDC works to prevent another epidemic like SARS during the Olympics. Plus, help is on the way for injured Olympic tourists and athletes alike, right down to China's version of 911. Finally, get rid of that throbbing headache with your feet. All coming up now on Beijing, Are You Ready? For elite athletes like world champion gymnast Zhang Nan, injuries are a fact of athletic life.
作为一个运动员，任何一个运动员，又或者是说任何一个项目的运动员，都是不可能没有伤的。
That's why physical therapists are on her team of coaches, trainers, and doctors. Dr. Bob Chen is a former pro water polo player and coach with a PhD in physical therapy.
Injury most happen in ankle, knee, lower back, shoulder, and sometimes they even have problem with neck, wrist, elbow, almost everywhere.
Originally from Hong Kong, Dr. Chan got his degrees in the U.S. and has been on the faculties of New York University, Harvard, USC, and more. Currently, he's a professor at Hong Kong Polytechnic University, assigned to the Beijing Olympic Committee to help provide health and ongoing healing to the Chinese national gymnastics team. His treatment strategy reflects his life, a blend of East and West.
I am primarily using the Western physical therapy technique in combining with the Chinese traditional method, 推拿, deep tissue massage, sport massage, or manipulation to help them to feel better, to relieve the pain and muscle spasm. But of course, we also use a lot of what we call a Western technique, like muscle stretching, muscle energy technique, and all kind of different techniques that we found that best to use in sport.
An injury doesn't mean an instant vacation from rigorous training for a gymnast. Time lost recuperating can mean forfeiting a medal or losing a chance to even go to the Olympics. Even athletes who aren't dealing with injuries worry about them. Tung Haibin went to the 2004 Olympic Games, but he says he can't sit on his laurels. He needs every day of training possible.
训练中，主要担心就是受伤。
Once again, Bob and his team are there to make sure these young men and women and their Olympic dreams are safe.
A lot of people have shoulder problem for the ring exercise. They need to really working on the muscle balance between the front and the back, and also the small muscle group inside to keep the muscle strong and joint stable.
But it seems that Dr. Bob Chan's work with the Chinese team members helps him as much as it does them.
Even though at the time I was in New York and I was waiting at the TV set and waiting for the good news. And when the good news came, and my family, my wife and myself, very happy because I found that at last we have an Olympic at home where we can show the world what the Chinese culture, the Chinese people, and also the sport in China. And I feel like I want to go back to help the Olympic and make it a better show to the world.
So when Bob brought his blend of art and science to China's Olympic gymnastics team, he brought something else too, his heart. He just had to be part of his homeland's race to win gold at the first Olympics ever held on Chinese soil.
There's one thing I have no doubt in my mind is the gymnastics team will do much better than last Olympic in Athens Olympic 2004.
If that happens, part of their success could be due to the work of physical therapists like Dr. Bob Chan. Every Olympic athlete is a daredevil. They invest everything into the dream, their childhoods, their teenage years, and their young adulthood, and they do it knowing it could all be over in a second.
就是自己得求对方犯规，然后就摔倒了，摔倒以后，然后就憋在那了。当时，心情特别差，然后觉得心里没底儿，然后什么时候能好，什么时候能恢复到比赛状态，心里特别没底儿。
When Olympic dreams are shattered by injury, this is where they're put back together. Peking University Third Hospital. Doctors here supervise the treatment of all sports injuries sustained by Chinese Olympic athletes. Sometimes doctors have to make heartbreaking decisions for injured athletes.
And we have a final say for all the athletes. If they can continue the training, competition, or they need to stop.
But first, they do everything they can to salvage the dream, as they've done with Chinese national soccer team player Yu Hanchao. During a soccer match, Yu collided with an opponent and ruptured his medial ligament. Doctors had to reconstruct the ligament, but during surgery, they discovered his medial meniscus was also injured. They had to cut part of it out. Doctors performed the surgery 2 days ago. Now comes the hard work for Yu Hanchao. Rehabilitation.
From the first day post-operation, we ask the patient to do straight leg raising, 把腿抬高一点，抬起来，对 ，okay, like this, and like this, and then every day, okay, 放下去， and every day we ask patients to do, we call the ankle pump, okay, this we call the ankle pump. We also ask them to do relax and the contracture of the we call it the quadriceps muscle. So like here, because here we have the cotton pad, so we can see it clearly. 做就是收缩，甚至收缩，然后放松，然后收缩 ，OK， 放松。And in this way, we can prevent the muscle wither.
It's only going to get harder. Yu Hanchao can look forward to 3 more months of rehab before he plays soccer again. Yu's treatment is a combination of both Western and Chinese medicine.
We never say this kind of injury only you can use the Eastern medicine, or this one you should use the Western medicine. We don't do that. We put together.